I've reversed over 10 overdoses in my life now.
So here on Skid Row, I have experienced one overdose experience with Narcan and dealing with it. Fortunately, I was with the medical team because I was kind of nervous in general.
There has been a few reversals that I have done here at Skid Row with our team and our nurses.
However, you just have to stand on your toes and understand, like, this person needs you, and we carry the Narcan to reverse these type of things, and we are the only one there that's really going to help in that moment.
There's one in particular that stands out where a gentleman was in between one of our coworkers' car on the sidewalk. He was already purple, and I remember the nurses and my team here at C3, we helped him get out of the gutter, literally started administering Narcan and performing CPR. And I remember when I was doing the compressions, I remember hearing his cartilage like breaking, and the nurse just guided me, said, keep going.
I was in recovery at the time and was part of, 12-step programs. Enjoyed them for what they were, the community they provided and some of the steps that they took, but also felt and saw within that community a lot of shame and stigma. I had several clients who, when they did relapse, it sent them into such a shame cycle that they ended up leaving, isolating themselves, and then used more and ended up overdosing and dying. I do believe, had they been met with a harm reduction approach, that those circumstances could have been much different.
When a problem advances this far and gets this serious, I believe that we have a legacy of community and grassroots organizations attempting to help, and anything we can do to help mobilize people who want this situation to change dramatically, we can fund and get people out there to do it.
Substance use is a symptom of trauma and pain and everything else that our folks are going through, so it makes sense that they're using whatever coping mechanisms they have, because they don't have access to a lot of services that a lot of privileged folks do.
I don't save lives, we don't save lives, but harm reduction saves lives.
Harm reduction has a chance to help dignify and change how we engage in community and with one another and with the ill and with the mad and with the people who are suffering, and I think it is on all of us to protect one another.
Coming to the people concern has really reinforced my own values about how I want to be compassionate towards people rather than holding boundaries and conditions for folks that don't seem to make sense when they're asking for help. The people concern truly wants to help people without condition.